for patients with acute myeloid leukemia requiring allogeneic stem cell transplant, the ideal donor source is match-related donors. However, for patients lacking a match-related match sibling donor, match-unrelated donor was historically the preferred approach. However, recently, for many centers, haploidentical stem cell transplant has been even chosen beforehand based on multiple studies reporting similar outcomes after haplotransplant and match-unrelated donors. However, these studies were extremely heterogeneous in terms of disease characteristics, disease status at transplant, and importantly, in terms of the conditioning regimen. Therefore, within the EBMT Acute Leukemia Working Party, we performed this registry-based analysis in which we compared transplant outcomes of 708 AML patients receiving haplo-HSCT using Thiotepa, Busulfan, Fludarabine, what we call the TBF conditioning with post-transplant cyclophosphamide, to 2,083 patients receiving match-unrelated donor transplant using Fludarabine Busulfan conditioning and in vivo T-cell depletion. So both being among the most frequently used and the most popular regimens in these respective settings. So all analyses were stratified according to disease status at transplant and according to the cytogenetic risk group for patient transplanted in CR1, which means that we had CR1 intermediate risk, CR1 high risk, CR2 patient, and patient with active disease. So median follow-up of a live patient was 21 months for patients who received haplo-TBF and 24 months for patients who received match-unrelated donor FB. So in terms of results, compared to match-unrelated donor Fludarabine Busulfan, the haplo-TBF approach increased non-relapse mortality, but significantly reduced the relapse incidence in high-risk AML, and this was particularly obvious in patients in high-risk CR1 as well as in patients transplanted in CR2. So this reduction in relapse incidence eliminated the increase of non-relapse mortality and resulted in similar leukemia-free survival, overall survival, and GVHD-free, relapse-free survival. So these results of this very large registry cohort and with quite homogeneous groups of patients receiving a homogeneous conditioning with Fludarabine Busulfan and match-unrelated donor, or with Thiotepa Busulfan Fludarabine and haploidentical donor. So these results support the use of a haploidentical family donor in a T-cell replete setting for AML patients lacking a matched sibling donor, regardless of disease status at transplant, and particularly and specifically for high-risk patients, high-risk CR1, CR2, and active disease, for whom you may not have the luxury to wait for securing a much unrelated donor.